Such a bright day to round up on the shoulder anatomy. And rounding up on the shoulder anatomy, I have this video for you guys. I have this video on the Bursae of the shoulder anatomy. And in this video, I don't know, but as for me, I feel that as a medical student, when you learn about something, you should actually know the clinical correlation of this thing you just learned about. Okay, so today I'll be talking about the Bursae of the shoulder joint. I'll take you guys through the meaning of the Bursae. I'll take you guys through the different types of Bursae we have on the shoulder joint, and I'll take you guys through the injuries to this Bursae, that's the bursitis. Okay, so guys, without wasting time, okay, I would just like to introduce myself. Okay, this is the MBBS Niger YouTube channel. If you are watching this video and you haven't subscribed to our channel, do subscribe to our channel, because we have lots of videos coming in for you, and we are here to make things so easy for you. All of us are students, so we are here to lend a helping hand to you, and you lend a helping hand to us too. So how can you help us? You can help us by liking our videos, commenting on our videos, and subscribing to our channels. Okay guys, we ain't wasting no time. We ain't about to waste no time today. Alright, so let's go to the top of the lecture. So we start up with business. Bursae in relation to the shoulder joint. So now, rounding up with the shoulder joint, we go. A synovial bursa, plural bursae or bursas, is a small fluid-filled sac lined by synovial membrane with an inner capillary layer of viscous synovial fluid, similar in consistency to that of a raw egg. Okay, it provides a cushion between bones and tendons and or muscles around a joint. Okay, so synovial joint is like a lubricating stuff. Okay, when your machine is not working well, then you like carry engine oil to like lubricate it. All right, when your door is making so much noise, you could take your oil to lubricate the hinge of you lubricate the hinge of the door. Okay, so this is just to try to tell you that technology actually stole from the human body so that we could actually develop technology. All right, so the bursa is just like the lubricating stuff of a joint. So simple. Do you know why when I talk you understand me better? Is because we are all students. If you go through YouTube channel of teachers, they actually don't relate to you like squad. We don't relate like colleagues, all right? But I'm a student. You are a student too. That's why we relate better. If you are watching this video and you are not a student, the reason why we relate better is because you came to this channel with that aim to learn. Okay, so let's move around. This helps to reduce friction. I told you it's a lubricating stuff between the bones and allow free movement. Bursae are found around most major joints of the body, but today we will be talking about the shoulder joint, baby. We're talking about the shoulder joint. So this is not the shoulder joint, but this is a diagram of a typical joint. Now you can see the bursa by the side. This is actually the knee joint. Now the knee joint and the shoulder joint, the knee joint is analogous to the shoulder joint. You understand? The lower limb is somehow like the upper limb, so they have similarities. Okay, you could see the bursa here. You could see the synovial cavity. The synovia is like, okay, the engine oil of the body. Okay, helps lubricate bones. The bones are like the metals of the body. Okay, so flex up. You can see this picture. I don't want to talk much about the picture because it's in the shoulder joint. So this is the shoulder joint. All right, shoulder joint, made up of the head of the humerus and the glenoid fossa of the scapula. So let's move. So This picture is showing the tendon, the shoulder joint, but it's actually showing off the rotator cuff injury. This place that you see a red out stuff, right? So if you don't know what the rotator cuff tear is, I actually made a video on the rotator cuff. Just go through my YouTube channel, scroll down, and you would see a video on the rotator cuff. So moving forward, guys, coming properly to the bursae of the shoulder joint. What are the various bursa we have on the shoulder joint? We have the subscapularis bursa, we have the infraspinatus bursa, we have the subacromial bursa. And in this tutorial, all these bursas are important. But talking about bursitis, that's the injuries to the bursa that is commonly injured is the subacromial bursa. Alright, so the subscapularis bursa is between the subscapularis tendon and the capsule. Infraspinatus bursa is between the infraspinatus tendon and the capsule. Subacromial bursa is between the deltoid muscle, the supraspinatus and the capsule. So now you know why the subacromial bursa is the most commonly fractured. Okay, you get to see that it's between the deltoid muscle, supraspinatus muscle, is between many muscles, and most of these muscles, they move. Okay, so as they move, this can actually get injured. In the shoulder, the subacromial bursae cushion is the area between the rotator cuff tendons and the acromion. That's the highest point of the shoulder blade of the scapula. Bursae allow the tendons and bones to glide without friction when you move and lift your hands. So I would say that, I tell you that, okay, bursitis is common when you do overhead jobs, you paint your house. So this picture is actually depicting the different bursas we have on the shoulder joint and their names. You could see the subcoracoid bursa, subscapularis bursa, subcoracoid bursa can also be the infraspinatus bursa. You could see the subacromial bursa too. Okay, guys, trying to move quick. The clinical correlation to the bursae of the shoulder joint. Bursitis by definition is the inflammation or irritation of the bursa sac. When the bursa becomes swollen, the sac itself can develop little tears and may cause tears to the surrounding soft tissue. In some cases, the inflamed bursa also becomes infected with bacteria referred to as septic bursitis, and it is necessary to see a doctor to get rid of the infection. Alright, you should tell you that bursitis could be mild, bursitis could be severe too. Alright, okay, so moving down, the subacromial bursa is the bursa in the shoulder that is most commonly affected by bursitis. It acts as a cushion to allow the supraspinatus tendon to slide smoothly over the neighboring soft tissue and bone. Due to its location and relation to the acromion and the supraspinatus, the subacromial bursa tends to be most at risk of being impinged or irritated. Alright, so moving down, treatment to bursitis if you have bursitis. Okay, guys, I actually went through this briefly, but you had to play this video again and you had to note down the locations of the three different bursas in the shoulder joint. Okay, infraspinatus bursa, subscapularis bursa, so on and so forth. Treatment: your doctor may aspirate the inflamed bursa. You know the bursa contains a liquid, so when it is inflamed, this liquid could actually turn out to become mucus and stuff. I don't know if I'm making sense. So aspirate is like take it out. This may involve removing the extra fluid that has built up with a needle. Okay, in mild cases, this could actually solve your issue. Sometimes the fluid will be tested at the laboratory to rule out infection. So let me say you have this inflammation, then they are just here to make sure that, okay, viruses and bacteria are not actually going through this infection. Okay, if your bursitis does not get better with conservative treatment, a subacromial depression may be done. It is an arthroscopic procedure. So incisions are made and a pencil-sized camera is inserted into the shoulder. A small shaver is inserted into another incision and is used to remove the swollen bursa altogether. The surgeon will then look for any damage to the rotator cuff. If the subacromial space is small, the surgeon may use a board to shave the acromion down in order to create more space for the rotator cuff tendons. This is also done to remove any bone spurs in the shoulder. Okay guys, with this I've come to the end of this video, and if you are watching this video from any part of the world, we could become friends. You could keep up with my videos by simply subscribing to my channel. If you watched this video and it made sense to you, you could comment, you could like this video too. So hope to see you guys on the next lecture. I have not really planned out my next schedule because I always plan out 10 videos that I'll make. All right, I actually plan out 10 videos that I'll make. So see you guys in the next video. All right, stick to my channel. I'm here to lend a helping hand to every medical student worldwide. I loved pictures. I loved learning anatomy with pictures, and I actually extended this to everybody. So love yours. See you guys in the next lecture.